Thank you for the support every week, logging into the live and asking your questions. I love it, and that's why I keep on doing it. We meet every Tuesday afternoon to go over different topics in plastic surgery, and I get to answer your questions. So today we're going to be talking about breasts, and specifically about capsulectomy. When do we need to do it, and why do we need to do it? Capsulectomy is basically removal of the capsule. So let's start by defining what's a breast capsule. So whenever we have a foreign body inserted in our body, like a breast implant, our body creates a scar tissue around it that we call a capsule. This happens with any foreign material that is inserted in our bodies. Breast implants, but for example, a joint prosthesis like a knee replacement or a hip replacement, med cords, which are catheters that are put under the skin and the chest when you need chemotherapy for cancer treatments or other medical conditions. Anywhere where we put something that it's not from our body, the body will create a capsule. The capsule is not a disease. The capsule is not our enemy. Actually, the capsule helps the implant stay in place. So the capsule is not our enemy, but the capsule may become problematic when we have different conditions. So I will go over those basically three main conditions where capsulectomy is indicated, and then we'll talk a little bit about when, like an implant exchange or removal, if we need to do a capsulectomy or not. So to review, capsulectomy, capsulectomy, whenever you see this ending in any medical term, is removal. So removal of the capsule. So let's start by capsular contracture. Capsular contracture is basically the disease or entity that is the most common cause or the most common condition that we need to do a capsulectomy, okay? So when this capsule becomes hard or thickened, it may then distort the implant shape, cause pain, deformity, and that's when we have this grading system that we have to put in the diagnosis, and then we decide if we need to do a non-operative treatment or we need to operate on the patient, okay? So grade 1 capsule is a soft capsule, is a benign capsule. With a grade 1, we don't do anything, we just observe because it's not causing any pain, discomfort, or asymmetry or change in shape. When we have a grade 2 capsular contracture, patient may see some discomfort or feel, and when you feel it, it may feel a little bit harder than the other side, but it's not painful and it's not asymmetric. So both of the breasts look normal, but the patient reports, but I still feel a little bit discomfort, or I feel a little bit harder when I touch it to the other side. For grade 2, most of the time you can do non-operative treatment, which consists of massages and adding Singler or Montelukast. This is an allergy medication. I've had other physicians or patients look me or write to me back saying, why are you ordering an allergy medication for a breast? That doesn't make any sense. Well, there are a lot of articles in the literature supporting the benefit of this medication, capsular contracture. So it's not that I'm crazy, it is documented, it is actually improving for grade 2 or 3 mild cases of capsular contracture. When we're talking about grade 3 and 4, grade 3, we start to see some deformity. In grade 4, we have a severe contracture deformity of the implant. It's usually higher, harder, like a rock. Those cases don't usually respond to non-operative treatment, and then we have to do an operation, which is the capsulectomy, right? We have to remove that diseased capsule so the body can create a healthier new one. When we are doing it for capsular contracture, there are a few things that we need to add to decrease the chances of capsular contracture coming back. Because we know that it's either a genetic thing, you're more predisposed to create a thicker capsule, or there is some inflammatory mediators like bacterial overgrowth or some inflammatory conditions that may predispose you to it. So what are the things that we need to do when we're removing this capsule to decrease the chances of capsular contracture coming back? One of those is changing the plane to under the muscle. the muscle is more vascularized and provides a bed for the capsule to form in a healthier way. So if you have a subglandular implant, you remove that implant and that capsule and put the implant under the muscle. Sometimes adding a mesh may contribute to a decrease in capsular contracture rate, and also adding this medication that I mentioned for 6 months after, and adding massages in the early post-op period to decrease the chances of capsular contracture, okay? So when do we do capsulectomy? Capsular contracture grade 3 or 4. Why? To remove that diseased capsule, okay? Let's go to the second topic. This topic is a little bit controversial, and we can do an entire Tuesday tips about breast implant illness, which I have done in the past, but I can certainly do it again if you guys want me to go into detail and more information about this topic. But I wanted to bring it up because it is one of the illnesses and conditions that patients ask for a capsulectomy, right? I want the implant removed and I want the capsule removed. What is the evidence behind this? So breast implant illness is a condition that we see some symptoms associated with breast implants. The symptoms are very diverse. So we have fogginess, joint pain, muscle aches, decrease in sleeping patterns. It goes like, it's very, very broad. And the reality is all of the studies that have been done following patients that report breast implant illness symptoms and get a capsulectomy and implant removal, and that tissue has been examined and checked in the lab, in the pathology, checking for everything. We haven't seen any incidents of autoimmune conditions against the implant, allergies against the implant, toxins such as metals in the implant or in the blood. So we don't really know what directly is causing it, but we do know that 60 to 70% of patients that report the symptoms and get the implant removed improve. Not with the capsule. So the majority of patients improve just by the implant removed with or without the capsule. So capsulectomy, it is not necessary when we're doing a removal for breast implant illness, and your symptoms usually improve after the breast implant is removed. Why not remove the capsule? A lot of patients say, like, you're gonna be there, why don't remove the implant and the capsule? A capsulectomy increases surgical time, increases anesthesia time, and increases complications. That capsule may be adhered to your chest wall and to the bones of the ribs sometimes. So sometimes it is a very easy procedure that it swipes away very easily, but in some cases it may predispose you to complications such as bleeding or chest wall injury trying to remove that capsule. So when do we do a capsulectomy? When it is necessary. We don't want to do any procedure if you don't really need it, right? Because that increases the risk of complications and the risk of having other things come up, right? So in breast implant illness, en bloc capsulectomy is not needed. A total capsulectomy, which is removal of that capsule with the implant, is done if it is safe and if it's not attached to the chest wall. But it is shown that it's not needed as part of the procedure, okay? Let's go to this one. This one is very important because these two are types of cancers that have been associated with textured implants. Textured implants are not used in the United States anymore since I believe it was 2018. So if you have implants after that in the US, you don't have to worry. If you had implants placed before, you have to check your implant card or call your surgeon, because if you have textured implants in place, the recommendation is to talk to your surgeon and consider changing to a smooth implant. And that is the implant type. So all of the implants that I place are smooth, which means the coverage of the implant is soft and smooth, okay? Textured implants are like rough in the edges. That increases the inflammation in the capsule, which has been associated with BIA is breast implant associated. This type of cancer is a lymphoma, anaplastic large cell lymphoma. This is a squamous cell carcinoma, okay? Those two are extremely rare cancers, but all of them have been associated with textured implants. If you have a diagnosis of any of these two, capsulectomy is indicated. We have to remove the implant, and we have to remove that capsule, which was the source of the cancer. Okay, so if you do have diagnosis, then yes, then capsulectomy, it is indicated. Okay, let's go to, I don't have any problem with the capsule. I don't have capsular contracture. I don't have any malignancy associated with the capsule. I don't have any symptoms of breast implant illness. I just want the implant to be rather removed because I'm tired of that volume. I want to go without implants. I had fun. I have this, this is so funny. Every time I hear this, it cracks me up. All the patients are like, I had fun with my implants, but I am done with that and I want to move on. Okay, so we remove the implants. That's fine. Do we need to remove the capsule or not? The reality is we don't need to remove the capsule, okay? I do remove the capsule if it's just a removal, just to remove that scar tissue from there. Again, if it's not attached to your chest wall. If it isn't gonna increase risk of bleeding or any other problems, I leave it behind. There is no association with increased like infections or anything leaving that scar tissue behind, so you don't have to worry about any problems coming up with this. But a lot of patients that, for example, they're in the 70s and 80s, they just want the implants to be removed. They don't care about the breast lift or any aesthetic improvement of the breast. They just want the implants out. It is a very short procedure that can be done through a small incision, removing the implant, leaving the capsule behind, and you don't have any other risks regarding bleeding or wound healing problems or anything like that, okay? So if it's just a removal, it doesn't have to be removed. I usually remove it if it's clean and it comes out easily, but not increasing over time or risk of bleeding or chest wall injury. If it's an implant exchange and you don't have any problems with the implant, I actually don't want to do a capsulectomy. I want that healthy capsule to support the new implant, okay? So if we're just doing an exchange, I open the capsule, remove that old implant, examine the capsule, make sure there's not a mass, fluid, anything concerning. Sometimes, especially if we're putting a smaller implant, I have to do suturing of that capsule to make that capsule smaller to fit the new implant size, and then put the new implant, and the results are a lot better because we already have like a bra supporting that implant in place, okay? So when do we have to do a capsulectomy? Definitely capsular contracture grade 3 and 4. Breast implant illness, not really, and if it's a malignancy, okay? I'll take some questions now if you guys have it.
Okay, let's start with this one. Mariana says, how can I know if my breast implants are encapsulated? I got mine 16 years ago and I haven't replaced them. I've lost good amount of weight and I'm noticing the implants are pretty above.
Okay, so not all the time that the implant is higher than the breast tissue means that it's encapsulated. Mainly is the shape. So if it's like harder and smaller than before, kind of contracted, that's encapsulated, or if it's painful. With time, weight loss changes, sometimes the breast tissue drops, and that's more like a water deformity. Basically, if you're looking at the breast on the side view, it looks like the implant is here and the breast tissue is here. The implant stayed basically in the chest and the breast tissue kind of dropped with time. So you get that deformity. This is not encapsulated. This is basically that the capsule stayed in place and the breast tissue drooped over time, okay? But basically those two things, the feel, if it feels very hard, especially asymmetric, and if it's painful.
Yes, that way, she said.
Yeah. So this, we can actually keep that capsule, just do a breast lift and change the implant depending on your goals with volume.
¿Cuál es la edad mínima para tener una cirugía de papada?
Yo diría que por lo menos seas mayor de edad, realmente. Después de los 18 años ya te puedes evaluar para una cirugía de papada. Lo que sí, todo va a depender de la elasticidad de la piel. Si eres más joven, pues tienes una buena elasticidad de la piel. So, la cirugía puede ser simplemente con liposucción y a lo mejor añadir algún aditivo de energía como es el Face Tight, que provee radiofrecuencia para mejorar la elasticidad de la piel y que se pegue y que tengas un resultado mejor. Si ya estás un poquito más avanzado en edad y tienes laxity o la piel suelta, pues a lo mejor necesitas un levantamiento de cuello que remueve ese exceso de piel y con la sutura pues se obtiene una mejor forma.
Is radiation treatment effective in preventing keloid scar returning after surgical removal?
Yes, that is actually, radiation is the treatment that it has been proven to be the best in reduction of keloid formation afterwards. So if you do have a keloid, and you're having excision of the keloid, you can combine it with radiation therapy. The radiation should be done within 24 hours of the excision, so it's something that you need to coordinate with your surgeon and have a radiation center in the vicinity of the surgery, because it doesn't have to be exactly the same day, but within 24 hours you should be getting the first radiation treatment, and you should be getting it for the next 3 days every day in the area of the incision to decrease the chances of recurrence.
For a mommy makeover, if traveling from out of state, how long do you recommend a patient stay in Miami?
Yes, so I recommend for majority of my surgeries, you'll be in Miami for at least 1 week. So I'll see you the day before the surgery day, and then I see you post up day 5 here in the office. If everything is good, then you'll be able to go back home.
Okay, would you say you prefer giving your BBL patients a natural look, or do you go by what they wish?
So, good question. It's a combination of both. What do I mean by that? I would definitely try to achieve your goals, right? I am not trying to impose my aesthetics in anyone. I know that everyone has different ideals of and different goals regarding body shape, and I completely respect that. But I am gonna orient you and explain to you, depending on your body shape, what's best, what can best be achieved, especially with one round, right? Sometimes people are asking for a very dramatic transformation regarding the hips, and sometimes that's not feasible with only just one round. And I'm just gonna let you know, it's not that I don't want to do it in one round, it's just that the body won't expand to the amounts that you're expecting it in one round, for example. But it's a combination of both. I would never do something that it's not gonna match your body. So I am gonna go with your goals, but that matches the rest of your physique, to then have those results last in the long run.
Okay, how long is a tummy tuck with lipo recovery, and how long after can you go back to work?
Good question. Tummy tuck recovery is usually the first 2 to 3 weeks are the ones that you're gonna feel a little bit more sore, that you're gonna need more help. So majority of my patients take off work 2 to 3 weeks. You will have drains for 2 to 3 weeks. So the safer is to take 3 weeks off, and that you maximize the chances of having both drains removed before you turn back to work. But returning back to work means that you have to still no lifting more than 10 pounds for 6 weeks, no exercising, so depends on your line of work, and not submerging in water. So if you work in a pool, then you will need to take 6 weeks off.
Or personal trainer?
Or personal trainer, or CrossFit, something like that. Then
Police?
Yeah. I have police officers that can do light work, and they put you on the office for a couple of weeks. I've had that. So it all depends, but majority 2 to 3 weeks.
How do you know what can be fixed with labiaplasty?
So labiaplasty, talking about the external genitalia, there are basically 3 areas that we can target. One is the mons, or the area that is like in the lower abdomen transition to pelvic area. That we can do a monsplasty, which is basically lifting that, or liposuction to that area. And in the labia, we have the labia majora, which is the hair-bearing labia or external one, and the labia minora, which is just inside that. The labia majora can lose fat and deflate or become elongated with time, and that can be either excised or filled with fat if it's deflated or wrinkly. And the labia minora, which is the most common labiaplasty procedure, is sometimes it elongates and becomes so long that it kind of gets caught in the underwear or bathing suit, or even in tight clothing like leggings, you can it gets bulky and you can see it. And the labiaplasty for the labia minora is excising it, so especially when you're standing up, you don't see the labia minora sticking out. It's basically tucked in and you just see the labia majora on the outside.
Okay. The last one, what happens if you don't have enough fat for a BBL? Can it just be a lift?
Yes, we can do just a buttock lift, and that sometimes is the best surgical procedure or indicated for patients of massive weight loss that don't have a lot of fat left behind. So it depends on your goals and the laxity in your buttock. But a buttock lift is something that can be done. Sometimes in select patients, what I do is a combination of a buttock lift, which the incision basically this is the buttock here, the incision goes like this in the top, basically lifting this. I combine it with liposuction of the back and then transfer fat to round those hips and add some volume. So it can be a combination of a buttock lift and fat transfer.
Okay.
That's it. Okay, you guys, thank you so much for all the questions. I hope this helped understand a little bit about what a capsulectomy is, when do we need to do it, and why. If you have any questions on this topic or any other topic, you can always DM me or put them in the comments, and I'll gladly be answering later on. And I'll be seeing you guys not next week, maybe next week. Yes, I'll be seeing you next week. Next week's the 4th of July. That's why 4th of July week. So that's why I'll let you know on Monday if I'll be able to see you guys on Tuesday. If not, definitely the following week. Have a beautiful holiday week if I don't see you next week, and take care.